Hello, everyone. Welcome to the Midlife Wellness MP podcast. My name is Kim Hefner. I'm a board-certified family nurse practitioner, menopause specialist, and host of this podcast. Well, today I'm excited about my guest. He has been named the breast explant illness expert due to his extensive experience in successfully treating patients with complications from their breast implants. He specializes in breast explant surgery, but also in other advanced cosmetic procedures, such as his no-cut facelift, which we are going to talk about today. He says he can change the way your face ages forever. He is well sought after because he has this awesome recovery program that decreases systemic inflammation and facilitates the way you heal after surgery, known as SHARP, which we'll also talk about today. I am excited to welcome Dr. Robert Whitman to the Midlife Wellness NP podcast. So welcome, Dr. Rob, to the podcast. Thanks for being here. I am thrilled to have this conversation. I've been really looking forward to it. So welcome.
Thanks for having me, and we will not let flights, trains, or automobiles get in the way of this discussion.
That's right. So I have to ask, I'm sure everybody starts with this, but what inspired you to become a breast explant surgeon?
So my whole background in training and then initially in practice was oncology driven. So I did a lot of oncologic reconstruction using microsurgery. So breast cancer is the most prevalent cancer we have that we do reconstruction for. And then I did reconstruction for head and neck cancer and sarcomas, which are tumors of extremities, as well as muscle, bone. They can be all over. So that was kind of, my practice was more geared towards that because we did and cared for so many breast cancer patients through reconstructive surgery. Of course, that became more and more the exposure. Part of that is reconstruction in breast cancer is typically predominantly actually done with implants. And the reason being is outside of a tertiary center where I worked, if you're in a smaller community, which obviously in this country, there's lots of communities that are smaller away from the big urban areas, that would be the most dominant type of form of reconstruction because it should be able to be performed at that community level of hospitals. So everybody listening, I worked at a big medical center with 5 different hospitals typically. And so I had access to all this, in terms of resources. We always had big teams taking care of patients. I had, very sophisticated instrumentation, operating room microscopes, great staff, ICU care, people to look after the patient. So it's a much different level of care that, I basically spent my career in. Now doing and performing breast reconstruction, taking care of those patients with implants, I got adept and experienced at dealing with implant-based problems. They'll typically have more and need more surgery because it's a device. I mean, that just is intuitive.
Mm-hmm.
So you'll get more problems with scarring, things like capsular contracture. The more they have treatments which are associated with care of a cancer patient, like chemotherapy, they're immunosuppressed. They'll have radiotherapy or radiation therapy. Those will lead to other issues. So it's a lot that you end up getting faced with and dealing with over time. And then it was a cancer patient who in 2016 asked me to actually remove their breast reconstruction to make them flat, which is a form of reconstructive surgery for them. And I took down her reconstruction. At that time on laboratory analysis, about a week later, we found that she had an E. coli infection.
Mm-hmm.
I believe she put me on a social media group. And then I just had people start calling the office, asking if we could do their explant. My team at that time was a little confused, didn't understand what was going on. And then, fast forward now, we've probably done over 3,000 explants and have a lot of, I think, good information. And there's more coming all the time about, root causes of this. And so we look at genetics and we look at toxicity burden, we look at gut health and the food and the hormone balance. And so we're trying to build out both surgical plans, supplementation, and detox for these patients.
Wow. Yeah. I know a lot more people are learning about it. I think with women in general, women often feel societal beauty standards to maybe get those implants in the first place, and often at a young age. So when women come in that maybe regret that decision and they're wanting to consider, explantation, how do you counsel women that maybe have those regrets and now are considering this procedure?
Sure. I think, we see that pretty routinely. There's body images that lead to, why they want to do this. Maybe they were bullied in school. Maybe that was just what they always thought was beautiful and that's what they wanted. Less tissue, kind of thinner person, it's pretty common. They may have not been counseled on something called a fat transfer, so that may have not even been discussed or learned in a consultative process, because if the kind of, everybody's got a different atmosphere and learning is going to be different. So there's two big peaks typically of breast augmentation. One in the younger patient population, we'll say 18 to 25, and then the second peak in the folks who've had children and breastfed, and now there's maybe deflation, the nipple complex is low set, sagging, whatever that looks like in that patient, and they're looking for some rejuvenative procedure. Those are the two big peaks. Usually that second one's in the 30s. We'll just say, mid 30s. I never really saw patients in the younger patient population because of where I worked. I was at a tertiary medical center, and one, I would have been hard to actually get an appointment to see based on my workload. And then two, the costs associated with that were never something that probably were feasible when they wanted to see me. The second group of patients are typically the patients who would come see me. They're older patients. They've already had children. It's probably economically easier for them to come and see someone like me with my experience level, and then learn about options like a fat transfer. So I'm sure everybody listening has heard of the Brazilian butt lift.
Yeah.
Yeah. So this is kind of like the Brazilian boob lift. And so
Okay.
we would add fat instead of an implant. Now, in the case of the buttocks augmentation, um, obviously that's a much bigger area. Even on a smaller patient, that's a much bigger area. And so you can easily put 500 cc's to 1,000 cc's per side, so per butt cheek, on a given patient. Now, of course, in a breast, that's a big difference because you have breast tissue, and then the fatty layer is where the fat belongs. So when you do that in the buttocks, just beneath the skin, but above the muscle, that's a big area. Like, just think of, you know, a buttocks compared to a breast. So I think there's a little confusion about the expectation. Like, you're not going to get a butt lift when you're doing it for a breast augmentation. So the amount you can put in is a function of, did you breastfeed? Is it, what's the skin like? How much space is there? And then you could put in maybe 2 to 400 cc's. Now, if it's somebody who's super young, really, really tight skin, no weight loss, weight gain, no breastfeeding, all those factors, you're not going to stretch the skin out to accommodate the fat transfer. So it's a different conversation.
Mhm.
It would take a young person steps to do that. Maybe in a one-time setting, a mom comes in, she's had kids, she's done having children, doesn't want a tummy tuck scar, just wants to have fat and some body reshaping. So instead of throwing it away, you use that to help augment the breast. I call that a holistic mommy makeover because there are other modalities we can use to tighten skin and do what is a more natural, more holistic transformation.
Mm. Wow. Yeah, I can't imagine getting that butt lift. I never thought about that in the first place. I know people do. So I think there's a growing awareness about breast implant illness. I mean, I personally don't know a lot about it, but I've been kind of reading up a little bit to talk with you. I can't wait for people to learn more about this because it is really becoming a more common health problem, I guess. So maybe we could just talk about what are some of the most common reasons that women come to you thinking they have breast implant illness?
Yeah, I think the confusion has been if you characterize it as a chronic inflammatory process where there's a medical device involved, it for me, it's a little bit more clear that way. So if you
Mm,
just took patients who didn't have implants versus patients who had implants but had lots of chronic inflammation, which we see routinely, that would be a function of their genetics, their diet, their environment, their hormone balance. And so we look at all those things specifically because typically, if that person who doesn't have implants has really poor detox, a very, very high toxic burden, poor gut health, lots of food sensitivities, lots of challenges in their hormones, then they're going to behave in a very similar way to the patient that has implants and has all those problems.
mm.
So that's, from a provider standpoint, if you have somebody come in who has every symptom that you can name, that's pretty confusing. So if someone has brain fog, headache, light sensitivity, sound sensitivity, dry eyes, difficulty swallowing, chest pain, shortness of breath, heart races, abdominal pain, swelling, bloating, um, constipation, diarrhea, muscle aches, joint pain, vibrations or shocky pain or burning pain all through their arms and legs. Like, what are you supposed to do with that person?
Right.
And that's basically how someone shows up. Now, the caveat being that I've, probably had over 4,000 consults with patients like this and done, you know, several thousand explants. So I just let everybody know, like, okay, you have chronic inflammation, getting your genes tested, getting your toxic burden evaluated, getting your gut health checked with stool testing, and getting a food sensitivity test plus hormone evaluation will help provide context to why you're experiencing what you're experiencing. So when you do, if you choose to do an explant procedure, you have these other things to work on to help get yourself well. I don't ever uh, I don't tell people what to do about surgery. I try to provide enough information so that they know this is a part of what can help them. And then, certainly, in our experience, those patients who have implant infections do well right away. But that's only about a third of the cases where we see biofilm, and that's pretty well documented in my practice. So that leaves a pretty large population that doesn't have that, but they have all these other issues or they're concordant.
Yeah. So the implants themselves are leading to this chronic inflammatory response. It sounds similar to just autoimmune disease in general. They have all these different complaints, which going back to the underlying cause, you're going to look at the same kind of things, right? The gut, the environment, all of that stuff. So do people, you know, is it like an autoimmune response to the implants, or is that what it's like?
I'm glad you brought that up because everybody who shows up will have experienced some discussion with autoimmunity and they'll mention it. So autoimmune disorders came to be, you know, past, we'll say, in the late 1800s, I think is when many of them have started to be described. Well, the first breast implant was placed in 1962. So obviously, autoimmune disorders predate implants. So once again, it's the person, and then, you can't pick your parents. You can't outrun a bad diet. If you have a really difficult set of environmental exposures, you're already fighting an uphill battle. And when you have a medical device, hip, knee, breast implant, dental implant, I mean, I just had Kelly Blodgett on my show talk about root canals and all the biofilm associated with what he finds on root canals. I mean, it's the environment's not getting easier to live in. So
Oh,
it's not,
doubt.
it's not surprising
Right.
that people are having more trouble, not less trouble. So we talk a lot about improvement of air quality, food quality, the quality of the fluids that you're taking in to help yourself getting, you know, restorative sleep. Like people try to shortcut all sorts of things, and it doesn't lead to a better state of well-being, or it's not going to let you have longevity. You're not going to function better when you're not addressing all these fundamental issues.
Right. Yeah, it's awesome for you as a surgeon to even be thinking about all of these other things because most of the time it's just, doing the procedure or, fixing what's already happened. So it's pretty cool that you work through all of these things to get to that point, which is awesome because overall, to heal from anything, you're going to need to do all of those things. We keep mentioning genetics. What genes or what would set people up for that? And then also for those people that don't understand what a biofilm is, maybe you could just break that down a little bit so people understand what you're talking about.
Sure, we can start with biofilm first. So, there's three ways to get an implant covered in biofilm. One, when they open an implant in the operating room and hand it to the surgeon, they can contaminate it.
Okay.
Two, the surgeon could contaminate it on placement.
Mhm.
And then three, which is by far the most common, is from a blood-borne bacterial or fungal type um, exposure. So think of like someone gets a skin cut and it gets inflamed and or infected.
Mm.
So that gets in your bloodstream. It can attach to any implant because implants are foreign bodies. They're not your tissues. So your tissues are surveilled and protected, and your immune system will take care of it. But those bacteria, fungal elements, mycobacterial elements love to find something that's not alive to latch onto and just hang out. And then some of them produce what's called a biofilm. They give it like a little coating that prevents your immune system from even clearing them.
Mhm.
So your immune system is turned on, revved up by this, but you can't clear it.
Mhm.
So it becomes a very, very stimulating thing to your immune system.
Right. Right.
And then
Yeah.
genetically, if you have a lot of difficulty with detoxification, say glucuronidation's a problem. So anything that has to do with your liver being able to detoxify and or your cellular energy production in the mitochondria, if you have limitations on detoxification of free radicals, that's going to lead to fatigue. If you have difficulty with vitamin D synthesis, if you have difficulty with methylation, which many people have heard of MTHFR, it's become like this common thing. Um, those all lead to problems with or limitations in your immunity and or staying inflamed longer, just recovery. Think of it like that. So all of those have downstream consequences.
Right. Okay. Yeah, that's awesome. Just to kind of clarify what we're talking about. Sometimes people don't know what we're talking about. So I want to talk a little bit about what you're kind of known for, or your recovery program is SHARP. If you could go through that, what that means and what that looks like for somebody that would be considering breast explant surgery.
Yeah, we created the process is really to be proactive. So I
Mhm.
think, how I was trained, I had great mentors and they were very rigid about understanding nutrition and patient care prior to surgery. Now, I will say the things that, fast forward, we know from integrative care are when we look at genetics, like we just mentioned, which is part of the program, we're trying to be really strategic. So now we use genetics in a way from Envision Labs, which is a new vendor that has drug metabolism.
Mm.
So, in addition to what we already mentioned regarding immunity, we're looking at how a patient individually processes medications that may, you know, make the recovery process a little bit more challenging for them. So everybody's had these stories of like, I'm really sensitive to medications. This really bothers me. And so this will help, I think, provide clarity to that. We do, as part of the sharp process, look at toxicity burden. So if you have grown up in an area with bad groundwater, like where I did, and drank out of the hose when you were a kid, like I did,
Mhm.
uh, you would have more arsenic in your system because that's the most common groundwater contaminant. So whether it's that or a toxin from mold or a environmental toxin like an herbicide or a pesticide like a glyphosate that's really found on foods from the spraying on the food supply when it's being grown. Like these are all things that affect um, your immune system, your endocrine system, and I always I don't, people like get freaked out when they have a food sensitivity test and they have a lot of sensitivities. I'm like, well, I don't think you started out that way. But the processing of the food that your body's seeing is stimulating your immune system to have a response, if that makes sense. So the combination is more the problem rather than the food. And when you check people over time after doing some work to rid themselves of some of these toxins, lo and behold, their food sensitivities resolve. So as you level up the food and the fluid quality and the air quality, things get better for you. So that's what we're always trying to do. And we look at gut health because having a poor gut microbiome where you have maybe too much H. pylori or you have a candida overgrowth or if you had a parasitic overgrowth, we're looking at absorption of nutrients to enhance and promote recovery. So if you had poor gut health, which a lot of my patients do, you could take all the wonderful supplements in the world and just make a lot of expensive poop.
Right.
So we've converted most of our supplementation that we can to a liquid. So it's a oral supplement and it's liquid or liposomal based so that you can get the nutrients you need without having to run downstream through the GI tract for everything, as that component of the whole picture gets worked on with our detox team, because people sometimes need a lot of gut healing in order to get completely healed. There's the gut brain axis, so we see a lot of disruption in that. We already mentioned food sensitivity. So you want to take things out of your diet that are super stimulating. Um, and if you have, say, say somebody has poor sulfur metabolism on genetics, like I do, well, we want to limit their cruciferous vegetables. So things like broccoli, for instance, which sounds great. It's a clean food, all
Right.
the things. But if I eat it, I don't really metabolize it well. So if I ate like a large quantity of that, that would be a problem for someone like me. Now I know that, and I do my workarounds and things like that. But if you don't know that and you're just trying to do your best to eat well, you can really, not help yourself, so to speak.
Right.
And then we look, excuse me, we look at hormone balance, and I try to leverage hormone balance to see if someone's got really suppressed levels of hormones or if they have too many hormones that are out of balance. Obviously, many of my patients will have high cortisol levels, and predominantly, we see a lot of estrogen toxicity for beta-listing. So genetically, you have an ability to break down your estrogen into estradiol, other products like estrone. But if you have an estrogen toxic type profile, you'll have too much estrone. Those lead to things like problems with endometriosis and PCOS and all the problems with difficult periods. So we have supplementation to holistically lower those through limiting, conversion of estrogen. So there are ways to work around it. Not everything needs a prescription. We do have prescription medications around the time of surgery for strategic parts of the process to limit nerve pain, decrease nausea, and inflammation. But it's all being proactive. So we're not trying to react to a problem. We're just trying to be proactive. We use a lot of nerve blocks for decreasing pain. So our patients are not getting as many medications that would make them groggy or drowsy, like long-acting narcotics. We're trying to avoid that.
Mm-hmm. Wow, that's awesome. I mean, I always think of leaky gut as like leaky brain. Like it makes total sense when you think about, what's if your gut's permeable, your brain's probably having the same problems, which is leading to all that brain fog and all of these sensitivities. And I don't think people realize how it all ties in together, but our systems all tie in together. So it makes total sense. So when people come in a part of this program, then essentially you're doing maybe a stool test, maybe some toxicity testing? Is that like Great Plains or something like that, like urine testing, like just a full panel of all these things that you put people through before you kind of consider the actual surgery then?
Right. For the detox program, the saliva test establishes the genetics, and we use the vendor Envision Labs for that. And then Vibrant Wellness, we do a total tox test and then a GI map. And then we like the LCAT 250 to look at food sensitivities. I've personally tried so many tests, and we've kind of settled on these. These have been consistent performers for us. And then there's a variety of labs that do blood work that we've used. So it's more about building out a picture. A lot of what we do is trying to really eliminate as much as we can upfront burdens or modify them, trying to get people really paying attention to their sleep and food and air and fluid qualities. And that makes a big difference. If you take gluten and dairy and processed foods out of someone's diet, it's like magic. If that's something that's really they're sensitive to, which a lot of people should and are sensitive to those elements.
Right. Yeah, I know what you're saying. It's like there's this thing I know with like on social media and all these things is like, don't listen to people that tell you you have to take gluten out of your diet. But I'm like, when I have my patients take gluten, just even gluten alone out of their diet, it's amazing how much better they feel. And they decrease the amount of swelling and they're even lose weight just taking gluten out of their diet. So I'm always like, yeah, you may not be testing positive to it, but it doesn't necessarily mean it's still good for you. It's still affecting your gut just from that alone.
Yeah, I mean, I think, if so, I have non-celiac gluten sensitivity for everybody listening, and I didn't know this for a very, very long time. So, I would eat things or I would, go out and have a beer and I wouldn't feel good the next day. And just like, what is wrong? What's going on? And then finally, this was sorted out on a genetic test for me, and I was like, oh my goodness, this makes sense. So I don't have celiac disease, which is even more complicated. um my daughter and I both have this non-celiac gluten sensitivity, but just as a lifestyle choice, we've made our household gluten free. And you know when you think about eating real food and not eating things out of bags or boxes, um, you're probably going to be headed down a better path.
Yeah. Right. Anyway, right,
Yeah.
exactly. So besides that, so people work through this process initially. I mean, how long does that take before they actually maybe go to surgery?
Yeah, it varies. If someone's really got specific issues that need to be worked on over time, they can have an explant or explant plus lift surgery. It can be a little bit more challenging the more surgery they want. So we'll have to, individualize their treatment plans based on the results. Some people, get started on the program and include surgery as part of the treatment plan. And
Mhm.
then others take their time due to logistics or how they're feeling. So each case is just individually based. I'm in Austin. Basically, we talked about it a little bit, but I have people here about a week to 10 days who are in the United States. I'm getting more and more clients from Europe, and I have them stay a few weeks because of the long flights. We
Mhm.
want to give them ample time to get acclimated, have their surgery, and it be as safe as possible, and have them experience all the things we have in the office, like hyperbaric oxygen therapy, lymphatic massage. We have a Balancer Pro that we use, and then red light therapy, of course, being available to be seen by the team if there's an issue, and then people will get themselves organized to go back. We have a great relationship with a gluten-free, dairy-free, seed oil-free restaurant in town called The Well. So we give our patients gift cards to go there. So we're trying to do all the things to make it as efficient as possible for them while they're here.
I was going to ask you actually what in-office other modalities you have to facilitate healing. And I'm glad you mentioned red light therapy. There's a lot of research on that. Maybe you could talk a little bit about that, but also about the hyperbaric oxygen. How does this help them post-surgery?
Yeah, so I think, I like hyperbaric as a modality. A mentor of mine who passed away, Dr. William Zamboni, he had tons of research on how it helped improve muscle ischemia and crush injuries and things of that nature. So we know adding oxygen helps. Um, Certainly, the most energy driven organ in the body is the brain. So providing more oxygen to your brain is always great. So
Right,
certainly clear up things after surgery relatively
right,
quickly. And for wound healing, obviously having a higher oxygen-rich environment helpful. You mentioned red light. I talked about lymphatic massage. So basically, the most efficient filtration system in your body is not a drain tube. I don't use drains. It's your lymphatic system. So we try to get the fluids out into the lymphatics, and that'll allow your kidneys to get it out of your body. Red light has been touted, obviously, to reduce inflammation. Of course, patients have inflammation both from their pre-existing issues and then I cause surgical inflammation. So trying to get that turned down. Um, yeah, all those things are. I like a multimodal approach, and we're always looking at adding and trying to improve on what we have.
right. I think I might have heard you talk about peptides. Do you use peptides as well? How do those work for people that don't know what that means?
Yeah, I mean, interestingly enough, the FDA, uh, I limited our use of peptides when the FDA recently started to question the safety of them, which is odd because they've been
Mhm.
out for a very long time, specifically something like BPC 157, which is great for recovery. So that was the main thing that we recommended.
Uh,
So basically, until that's been, sorted out by the FDA, uh, we obviously know and had experience with it. I've just paused our use of it in our practice. So there's no scrutiny of that. But yes, it's been effective. It's not new. I don't know in particular why it got so much attention, but it's not my thing to figure out.
right.
We have stem cell therapy in the office as well, which are your own stem cells that can be done with your own fat cells. So these are not like new things. So they've been around a very long period of time, but they always get scrutiny. And so whatever. I mean, I don't.
So does hormone therapy, which is, finally coming around as well that, hey, this helps decrease women's all-cause mortality. Maybe we need to take a closer look at telling people to avoid it. So I'm not surprised by that. Um, what are some common misconceptions or myths surrounding breast explant surgery? What do people not know or get wrong when it comes to this?
I think there's way too much fixation on the implant as the main problem.
Okay.
So if that's how you approach it, then you're discounting what genetics, what food, fluid, air, gut health, hormone balance, all of those play a role in how you live. And in patients without breast implants, they play a role. So I think you want to have a complete understanding. And so I try to be very transparent. I
Right.
think third of the time ish, the implant has this biofilm. There's been papers published about the interaction of biofilm and the immune system. So obviously we know that's a real phenomenon that's not in question. I know that implants can certainly rev up the immune system. That is not in question either.
Hmm.
The whole thing I want people to understand is you need all the information. You want to have all of that testing because you want to have an outcome that when you look back on it, you did look at and evaluate and take inventory of all these things so that it's not something that can't be or shouldn't be worked through, like a process or a treatment plan of anything. You want to have the information that you can look at and refer back to. So say we have somebody with a toxicity test that's really poor. You want that beforehand so that afterwards, as you work through the process and are in the phases of healing and you're working through detoxification and you're really working hard on your diet and your sleep and everything, if something you get a point where you're stuck, well, you can always repeat that test and see, is there something specific that is not being addressed, or is there something new? Because as you methylate better, as your liver function improves, you'll detoxify other things. Your tests will change potentially, or you'll get new exposures. I mean, I don't want anybody to be, this is, I guess, demystifying this is the situation, because blood work doesn't identify the things I'm discussing. So you can have great blood work,
Right.
whatever. That is pointless in this. So, I expect you to have reasonable blood work. If you don't, then you got real problems. Like those are significantly, you need to go and you got to make sure that you're looking at everything. Most of my patients don't have blood work that is remarkable.
Mm.
It's all the other things I'm discussing through saliva testing, urine testing, stool testing, food sensitivity testing, hormone testing. Then you're getting a broader picture where that's the combination of the power of integrating care, right? There's allopathic care and then there's functional care, and we're trying to integrate those to get the best of both worlds.
I agree. I know people, allopathic medicine will criticize functional medicine and, go back and forth. But I'm like you, I like to use that, integrative approach, because how many times do you hear everything looks normal on the blood work, you're fine. But then, like you said, they're not really fine. I mean, they're having brain fog, fatigue, joint pain. That's not fine. So I do love that root cause approach where you're digging a little deeper and finding things like mold that can ultimately contribute to things like cancer, environmental things, all of those different things that play a role. I mean, I totally agree that integrative approach is the way to go. And ultimately, I think through this whole process, whether people want to find the cause. So if it's blaming the implant, that's what they want to do, right? But it's like
Right.
looking at the whole entire thing, getting to that root cause. And I think the explant can just be part of that overall whole body healing process, which is pretty cool. Um, Let's talk a little bit about just the procedure itself. What's that like? I know so many people probably want to know, like, what exactly do you do? How does this work?
Yeah, so when we're doing an explant, and just speaking about taking out the implant, we're trying to take out the scar tissue that's created around it, because that's where the biofilm will be harbored. If there's a breast implant associated anaplastic large cell lymphoma, it'll be against the implant typically. So we try to get all that material out together intact to the best of our ability each time. So think of like taking out an undisturbed Easter egg. The incisions can be different based on how they were placed or what the patient needs. So you could create a lift incision. You could use their old incision. Those just vary based on the patient. And then if we're adding fat back, we do that in a strategic way to go ahead and fill out the cleavage area, try to make the areas that are going to be really conspicuous, fill those. And so in the upper areas of the breast. So those are like the strategies. We do nerve blocks. We don't use drains. I think, for our patients, they arrive, here a day before, have surgery typically, and then spend the rest of the time coming, you know, to our office to have those hyperbaric treatments or lymphatic treatments or red light, and walking and having, nutrient dense supplements and meals and getting their rest that first, 7 to 10 days after surgery or longer. I encourage people to take what time is necessary for self-care. It's not easy to do that. Everybody has obviously jobs, lives, families, but you don't want to keep uh, not taking care of yourself because usually you're the caretaker of everybody else, if that makes sense. So this is a time where if you have to bring a friend, spouse, somebody has to help with the kids, like women are very driven to take care of everybody and then not take care of themselves very well. So it's a little bit of a struggle for me sometimes to get them organized in that mindset. And probably that's the biggest thing is, adopt a mindset where you need, to get yourself in a parasympathetic state and take care of yourself. Because although I can do all the surgical steps, I can provide all the pre-op programming, I can do all the post-op care, and my team can help do the detoxification, and we can have all the supplementation for you. If you're not a willing participant, it's not going to end in the way that we want it to. It's going to take longer. It's going to be more of a struggle when it doesn't have to be.
Right. Right. I think I was talking to somebody else. It's like optimal health requires your participation in it. So that's important. But with the incisions and most women, especially in midlife and beyond, you're losing estrogen, your breasts become more droopy, and so they're going to want to lift. So are the incisions that you make similar to what they used to be, where you do kind of like a lollipop? I guess you cut down the middle. Is that all the same in this type of procedure? And then where's the fat coming from typically? What if you don't have a lot of fat? How does that work?
Yeah, so the lift incisions are commonly that lollipop type incision. And the fat usually comes from the inner outer thighs, the love handle area, and to a lesser degree, abdomens. You always have to be careful with a woman's lower abdomen, especially if they've had kids, because you don't want to make it looser. So I do a lot of skin tightening, and that's done at the same time.
Okay.
So we try to respect and always. I'm talking to everybody about that because we're trying to do everything we can to help at one time. So that's commonly used. The procedure is called body tight. It's been around. I've had it since 2017, but it predates that. I've incorporated it into my practice um, for all those years, and it's become a really valuable tool to help tighten the skin in these areas. Because when you take fat away, you're going to, create some structural changes, and you want to
Hmm.
help tighten it. And that's just, trying to be intentional with how I'm doing it.
As far as the fat transfer, you might get this question. Are there any complications from having a fat transfer, and does it increase risk of breast cancer or difficulty with mammogram imaging?
Yeah, so basically, these were all kind of rooted out in the, you know, we'll say 2005-ish to 2015 era. Sometimes we just have to go back and look at that. There was a lot of discussions about does this affect and cause confusion with or imaging for breast cancer, and that's no. And then two, can it cause breast cancer? That's no. They're not the same type of cells, so
Okay.
those are all no. Now, longevity of a result, I always tell people the same thing. I'll tell you right now. Every result I try to create for somebody is easier when you're closer to 30 than 80.
Right. Makes sense.
So your hormones, metabolism, diet, overall toxicity burden, things like that should be better when you're younger. Not always, but generally speaking. And then it gets harder, obviously, as we get older because we become sarcopenic. Our hormones go off. We have more exposures over time, not less. And then genetically, how can we detoxify? So it's 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 a function of those, and I try to individualize it and get everybody positioned to have the most effective transfer possible based on their specific situation.
Mhm.
So um, if you just took a whole group of patients and did fat transfers on them with what I just said, they would all vary
Yeah.
because you're
Like,
not doing any upfront work to
yeah.
make sure that you're trying to level the playing field for them as much as possible.
Makes sense. Totally makes sense. Like as far as how long results last. Now, is this a cash-based procedure? Is there an ICD-10 code for breast plant illness or yeah.
So I think there's going to be groups working to help establish codes for this. There currently is not one. And in 2019, I eliminated insurance work for my practice after taking care of oncology patients for all those years. So as it currently stands, it's a fee-for-service procedure.
Hmm. Makes sense. I always tell patients too, that's where you're going to get the people that spend the most time with you. I mean, insurance maybe allows 15 minutes and, how's that going for you in the past, right? So it definitely takes a lot more. Real quick, I want to just ask you about your no-cut facelift. I know a lot of women are wanting to avoid invasive procedures and you're known for this procedure. So talk about that real quick before we get out of here.
Yeah, it took us several years and iterations of different treatment plans. So ultimately, the no-cut facelift is to bridge the gap between a surgical facelift, which is the gold standard, but many patients don't want to have a visible scar. In fact, none of them have ever came in my office and said, "Give me a visible scar, Dr. Whitfield."
Right. I want everyone to know.
Yeah. So that's number one. And then two, people don't want a unnatural appearance. So many times, and I always point to the award shows when you want to see somebody with an unnatural appearance, just have a peek at those. And then, you know, like finally, like at what point do you start like doing treatments and what does that look like? So I'll go back to the analogy before is the no cut facelift. It fits a niche for people who want to look natural, not have visible scarring. And so that's usually who's coming. The other thing is people that are pretty leery of general anesthesia, and we do this under local. So we can address the neck, the jowl area, the cheek area, the forehead, around the eyes, and we can remove skin without scarring. We can tighten the tissues, both superficially and deeper. And we can, once again, correct the neck. We can do this without stem cell treatment at the same time, or without exosome treatment at the same time. We put everybody in our hyperbaric chamber after, and we use red light therapy, of course. So like it encompasses basically my sharp process and then all the multimodal therapy we have for recovery afterwards to give a minimally invasive approach to facial aging to change how your face ages forever.
Yeah, that sounds good to me. That's awesome because I know a lot of women, a lot more stuff is happening in home. People are wanting devices and things that they can do without going through all of those things. So that's awesome. And I'm sure on your website you have before and afters for all of the procedures that you offer and that you've performed if people want to learn more about it. So is there anything that I didn't ask you that you wish that I would have or think that people need to know?
Well, relatively soon, my book comes out about Sharp. So that will be available. So anybody who obviously can't travel to see us or wants to learn more about our process and programming, that will be available. And they can go to drrobsolutions.com and that will actually be available for pre-order. There'll be more programming coming out for practitioners about that process and learning more about training your team and or surgeons regarding breast implant illness and explant surgery.
Awesome. And then real quick, just talk about your podcast and how people can follow you and find you. And you probably offer virtual consults for anyone everywhere in the world, right?
Yeah, we do virtuals, and you can follow us at Breast Implant Illness Expert and the same URL, breastimplantillnessexpert.com. And then on YouTube, we have our channel's been translated in I think several languages, and we'll have I think about 8 languages up here in the next quarter. So we're trying to make sure that the information that we put out both on the podcast and the YouTube channel is easy to digest, answers the questions. And if anybody has interesting questions, please hit us up and we'll try to answer them for you.
Yeah, that's awesome. So last question, if you had a giant billboard and all women considering getting breast implant surgery, what would you want to say to them if they were considering getting that procedure?
I think I would have them go through Sharp because then you would understand your genetics, your current toxicity level, gut health, hormone balance, food sensitivities. And then if you're armed with that information, then you just make your decision. And that's the decision you live with.
Right. Right. That's good. Well, thank you so much for your time. Thank you for being here. I've learned a lot, and everybody should go to your YouTube. You are breaking things down in, kind of bite-sized ways, explaining things, answering questions. So I really encourage listeners to go there and learn more about you. And yeah, thanks for all you do. It's been great talking to you.
Thank you for having me. I really appreciate it.
Yeah, thank you.